Hello, welcome to the Becky Boca Show. I have my own plastic surgeon here tonight. I love doing interviews with Dr. Art Handal from Handal Plastic Surgery. Anybody that lives in Boca Raton probably has driven past his center. It's on North Federal Highway, just past D'Amato Road.
Just north
on the west
of
side.
D'Amato, yes.
Beautiful freestanding clinic, and it's also, you were telling me it has the same certification as a hospital, right?
No, we're a fully licensed ambulatory surgery center. So at different levels of outpatient surgery, we have the highest that you can get.
Okay.
So we do all types of surgery there. We do orthopedics, plastic surgery, 2 licensed operating rooms, and
your brother is an orthopedist, correct?
He's an orthopedic surgeon.
Okay, so he works out of there too. It's a beautiful place. Anybody that knows Boca Raton knows it. I invited Dr. Handal in here just to catch up on the latest things that he's doing. But what I wanted to start with was fat grafting to the face, because you did it on me a few years ago. I think about 2 or 3 years ago.
Is it that long already, huh?
Yeah, I know.
Wow.
Time flies.
That's sad.
But I'm feeling younger.
It's going by too fast.
But you did it when you did my face, and I was telling you before we came on air that the fat never left the area. So it's like getting fillers that just stay there.
Well, the nice thing about fat, first of all, when you're doing a facelift, I always tell my patients that a young face, a youthful face, is not just a tight face. It's a face with more volume, because when we're younger, even though our bodies may be thinner, our faces are fuller. The opposite effects happens when we get older. Our faces thin out usually. We lose volume, and our bodies gain the weight. So what we try to do is reverse that process, and I usually have my patients bring in photographs when they were very young, and we hang them up in the operating room. And once I do the surgical part, the muscle tightening and the face lifting, then we restore the volume. And the nice thing about it, and it's not just during surgery, as a plastic surgeon, I'm able to do fillers as well as fat grafting. So when I
do everything, Botox, fillers.
We do it all.
Everything.
Botox and fillers are great. The nice thing about them, it's an instant result. You just sit in my exam chair. We do it that day. You get beautiful results. And the only negative thing about it is that they're expensive. And I try to be conscious of patients' pocketbooks too. So I'd like to give them the best result for what they pay for, and what their budget is, and try to give them the longest lasting result. So usually, in my opinion, if somebody needs more than 4 syringes of a filler, then they need surgery.
Okay, and you take the fat from the abdomen, correct?
I take the fat from anywhere you have excess fat, usually the abdomen, the hips, the back, or the upper inner thighs. Those are great areas to take fat. But wherever you have fat, and some of them theoretically have more stem cells, such as the upper inner thighs.
Okay.
But all the fat that is available is useful. And the good thing about the fillers, like I said, there's an instant result. But if you need more than 4 syringes, it gets pretty costly. And then that just means that you have a lot of excess skin.
Yeah.
And I rather either do a fat grafting session or surgery or both. So sometimes if you need more than 4 syringes, we can give you a lot more for your money with fat grafting. And the good thing about fat grafting is there is a degree of permanence with it.
I know that.
And there's stem cells.
Right.
And even as a year goes by post-op, you'll actually see improvements in the texture of your skin.
Mm-hmm. Wow. Because of the stem cells.
Because of the stem cells associated with the fat.
Okay. So do you do fat grafting as a standalone procedure, or is it always done with a face? So someone can just come in if they want to do that
if somebody comes in and, I say, listen, hey, we can get away with, 2 or 3 syringes will give you an improvement, but if you want a really good result, these are your options. You could use Sculptra, you could use this, you could that, but, if you want fat, if we do the fat grafting, you get a long-term result with that. It's your own tissue, and then I have the availability to use as many syringes as I need.
Does that have to be done in the OR?
That has to be done in the OR. It's all done under local anesthesia.
Is it surgery, or is it just injection? Withdrawing with a syringe and injecting?
It's non-invasive surgery. What you do is you localize a certain area of the body where you're obtaining the fat. Mm-hmm. We suction it out with a hand syringe because that protects the fat
So you're not
cells.
actually cutting into...
No, you're cutting
wow. Okay,
nothing at all. It's
okay,
all
we have pictures up here. This is a before picture of fat grafting?
A woman that I did fat grafting on.
Okay.
You could see she could have gotten some nice results with fillers, but not to the degree that I obtained with the fat grafting. And this picture is a year later.
Okay,
So
can we see the
next picture?
the next
you'll see.
picture?
All right, there
There
she
it is.
goes. So that's a year later. So
A year
generally-
later, and it's still okay.
So if you notice around the eyes that's been filled in, the cheeks, the lips, and the jawline. I even do the brow, because if you have a little bit of a saggy brow, you can actually lift it up without a forehead lift by
Wow.
putting some fat underneath the
So
brow.
all this is done with just fat grafting.
Just fat grafting.
Amazing.
Local anesthesia. We make them a little comfortable. We give them a couple of pills to take, a little sedation, and then we have Pronox, which is nitrous oxide, which they can puff on while they're
on
doing
their
the
own.
procedure.
Yeah, I was
and
in with Siggy when she was doing Siggy Flicker. She was.
it's so we're doing
There's no pain.
half my facelifts now are done with this technique.
Really?
Yes.
So the patients are awake.
They
just feel no pain.
They're barely awake,
Okay.
and initially
They don't remember it.
No, they have a little amnesia from the medication we give.
Okay.
But a lot of patients are concerned about anesthesia, especially the older patients. Mm-hmm. So we alleviate those concerns just by doing the local with sedation.
'Cause you don't need the
and
anesthesia.
Just oral sedation and just a little shot in the muscle, and it works very well. They're monitored, and you eliminate. And it's also very cost effective. They save a significant amount of money with anesthesia, but it's not
Right.
for everybody. I judge every patient what they can handle. Some patients they just look at a needle and they're very squeamish, but some patients they
So
have
those people might just want to be knocked out.
super high tolerance to anything. So,
And
but
there, I know people are afraid of anesthesia, but I did it with anesthesia, and you have an anesthesiologist there monitoring you the whole time.
well,
so
the type of surgery we did
Yeah.
on you, I think, required anesthesia. Because
Okay.
don't forget, we did laser,
Right.
and that's very painful. And there's
Right.
also a little bit of risk to use too much local anesthesia. So you
Okay.
can't use that much local anesthesia, and you have to judge everything. The stress on a patient is more. It's more stressful on the heart than because of the pain. So it's sometimes.
Oh, I
it's sa-
see. Yeah.
Anesthesia today is very safe. We always get medical clearance from our patients, and
Right.
as long as they're fine, you shouldn't have a problem.
Mm-hmm.
But we take a lot of factors into consideration, and we fine-tune the process so that with local anesthesia and a little bit of sedation, we can do a lot of surgeries
Yeah.
right now. A lot of liposuctions, but there's still some surgeries that require full anesthesia.
Okay, so if someone wants to come in and get this fat grafting to the face, how many hours does it take? How long are you in there? Are you fine
Generally,
immediately?
from the moment you walk into the office till you leave, it's about 2 hours.
That's it?
Yeah.
Oh my goodness! And when you leave, you're fine.
Yeah. Oh, yeah.
Wow.
I mean, sometimes we get less bruising with a fat grafting than we do with
Than you do with-
injections, with
Wow.
the injectables. Because with some of the injectables, especially around the eye area, there's a lot of little blood vessels there that can
Mm-hmm.
get perforated, and then you can get bruising. But with the fat grafting, you use a different technique. And we go deeper with the fat. We don't go close to the surface of the skin.
Oh, okay.
But, the injectables are great, too. Like,
Yeah.
for instance, around the eyes, they can last up to 2 years or more. It depends on the location of the face you put them in. And the other thing
Yeah.
we're doing a lot is the liquid rhinoplasty.
What is that?
So let's say somebody has a little bump on their nose
Mm-hmm.
and a little bit of a hump. If they don't want to undergo a rhinoplasty, you give the illusion that it's a straighter nose by putting a little
Oh.
filler behind the bump or in front of the bump.
Okay.
Or someone's had a bad rhinoplasty, because I do a lot of revision. I love noses, and we're about half the noses I do are revision noses, and they're pretty complicated procedures. You have to use cartilage grafting, and they get beautiful permanent results. However, if someone's not into that and they want a quick fix and they don't want to spend the money, they can get a beautiful result with a liquid rhino, and it lasts.
Wow.
I've seen some patients up to 3 years with the filler.
Oh, wow.
So that's another option that patients can have, and there's a lot of great things about these fillers, and it's great to have everything in your arsenal for treating
Yeah, I
patients.
used to use fillers before you did the fat grafting on me, and I always found that on me it lasted longer than people would think it would. I mean,
Well,
some
you
people
know-
say it only lasts a few months, but I used to get at least a
No.
year out of it.
With what, fillers?
Yeah.
Yeah, everybody's different, and it depends on the location of your face that you put it. Usually areas with a lot of movement, such as the lips, they tend to wear off a little quicker, but the nose or underneath the eyes, that can last
'Cause it's not moving.
years.
So can you fill in the little hollows under? Someone was just asking me about that today.
Yes,
Hollows under the eyes?
That's called a tear trough.
Okay.
And some people just naturally have it, or if they get a little bit of a puffy eyelid, instead of doing the surgery, you can camouflage it by filling in the valley next to the peak, so it makes it look like
Oh.
it's like you've had your eyes done. The other
Okay.
thing, as people age, they start to lose volume in the face, and the cheeks tend to slide down a little
Yep.
bit, and then you get the hollowness here. So by putting volume there with a filler there, it works great. We use a little cannula. We don't just use a needle.
Oh, so
That's
you
a little
pull it
less
through,
traumatic.
yeah.
It's a little less traumatic. And I give a little bit of local anesthetic there, and I let it sit there for a while so it vasoconstricts the blood vessels, so we minimize the bruising. And it works great. It works great. And so these are all nice little tools. So, like, we like to combine technology and fillers with surgery. And so a lot of these other technologies we have now, such as the radio frequency and the microneedling, that helps us improve the quality of our surgery because it improves the quality of the skin. And you could tune up a face that you've done, let's say, a couple of years ago, and then if you get a little bit of laxity, just by tuning it up with radio frequency and
interesting.
tightening the collagen, reorganizing the collagen fibers, you can get better longevity with your results.
Wow. Okay, we have another picture that I know we want to get to. This is the under the arm hair. What do you call this?
The upper
Right here.
arm laxity, right?
Okay, can we put up the before picture?
Okay, well, this is a problem that so many women, almost every
lots of
woman,
people complain about
even
it.
younger women, have this problem because the fact is that they're women, they have soft skin, and it's just like the upper inner thighs. That skin tends to be very lax. So we have different degrees of treatments for this depending on what the problem is. So obviously in a case like this, and this was a thin woman too. She wasn't very heavy.
Yeah,
She just
looks
had
like it.
very lax arms. So liposuction alone would not take care of that. She would have
Because
a
of the skin.
smaller arm, but she would have very saggy skin.
Yeah.
Then the next
There's
thing
the
you do,
after. That's amazing.
that's a full brachioplasty. So a lot of patients
Wow.
are afraid. They go, "Oh, I don't want the scar." But if you stitch it meticulously, like just the same way I stitch a facelift, you will have a beautiful result. And I think that it's well hidden. The only time you see something is at the first few months, and now we have
and over time.
scar creams.
Right,
We have
there's lots of things you
intense
can do.
pulse light. We treat them. So we treat our patients as part of our surgical procedures with intense pulse light or wherever we can do to just get them comfortable about their incisions. So that works.
And in Florida, that's so important because women don't wear sleeves much.
No, they don't
In
wear
Florida,
sleeves,
I almost
no.
never do, unless I'm trying to stay out of the sun. So you're running around a lot with this part of your arm
I
exposed.
find that they're more self-conscious about that than it's actually visible. So in other words, to the average person, they don't look that bad,
Don't
but
notice
they're
it.
very conscious about that. They're very conscious about the little wrinkling that they have
Up here.
in the texture of
Yeah.
the skin. So that's not just a laxity problem. That's more of a texture problem. That's why we use microneedling with the radio frequency. We have this device called Morpheus that has different settings of the depth of the needle. So it's all automated, and you can use it around the eyelids, or you could use it on the body. So it has different. Now we
It's
have a new
microneedling?
microneedling with
Okay.
radio frequency, and so
Oh,
it treats stretch
okay.
marks, it treats scars, it treats skin laxity, and now we have a new attachment for it that it has an ablative head to it. So at the same time, it's doing a little bit of resurfacing without the downtime of laser. CO2
An
laser,
ablated head
right?
on the needle.
On the device with the needles, yes.
Okay.
So the CO2 laser, unfortunately, is still the gold standard.
I think that's what you used on me.
For yes,
Yeah.
there's nothing beats it up to now as far as resurfacing is concerned, and you'll see some photographs of that later. But we have different levels of treatment for everybody, so now we have a wide range of treatments so that we can customize it for every patient.
Wow. Okay, so you just have to come in and get a consult, and you'll tell people what.
Yes,
Okay.
the most important thing is what's best for the patient.
Right.
So we'll see somebody and we'll tell them, you don't really. Sometimes I spend as much time trying to talk them out of a surgery as I
Because they have an idea what they need, and
am
then
talking them into one. So you kind of have a vision of what you want to see for your patient, and the most important thing is naturalness and get the best result possible.
one of the other procedures you did on me that I'm still so excited about was the
The endoscopic brow lift.
endoscopic brow lift, and it lifted my upper eyelids.
I love that procedure.
Yeah, that was really incredible.
I love that procedure because, like I've explained in the past, when you look at somebody, to me, the most important thing about someone's face is their eyes. So when I look at someone, I look at their eyes first. I'm not scrutinizing their neck or anything else. So, and the eyes are the window to your face, your soul, your eye. You know how you're tired, you're sad, you're angry, and if you have your eyes done wrong, they will make you look like a different person. You'll become unrecognizable. And if so, the biggest problem with the upper lids is some people have hooded lids, such as myself. Some people have hollow upper lids. They don't have that excess skin. So you don't want to take a person with hooded lids and make them look
Different.
with a hollowed eye, because it just makes them look like a different person. There's some celebrities who've had that procedure, and they always talk about them. But the reason why you're starting getting crowding up of the upper lid is, and it's more noticeable in a hooded lid person because the brow starts descending. So with a brow lift, you reverse that. You put the brow to the proper
That
arch.
was an amazing procedure. I know you attached little
They're endotines.
they're like, I want to say screws, but
Yeah, well, no,
up
they're
here.
little dissolvable devices that basically look like triangular carpet tacks.
Okay.
So when you do all the surgical part about releasing the brow and getting rid of the frown lines, and you're all ready to reset it, you put these little endotines in, and you pull back the scalp to the proper tension, and you snap it on there. And in about 3 to 4 months, they completely dissolve.
Yeah, I remember that. I could feel them on my head, and then eventually they just toward the end there, you could kind of like break them up.
After about 2-3 months, you could start mashing them. They start dissolving.
And then
It's the
they
same thing that
disappear.
stitches are made out
So
of.
then the skin just stays where it was at
Within
that point?
3 weeks, your scalp will already start to
Be where
stick to the new position. That's what's great about it. So you don't lose hair.
No.
You don't have sensation issues, which are permanent. You don't have loss of hair.
Right.
We actually part the hair where we're going to make the incision parallel to the hair follicles, and
So you don't destroy
virtually
any
no
of them.
scar. I mean, we do it on balding men.
And you can't even see it?
You can't see it.
Wow. But now let's talk about your hair transplant with the PRP, because I remember I brought that friend in from California and watched you do it. I was even amazed at the results that he got, because he was pretty much bald all up here. He had hair down here. So
I
you
believe
took
we put about 2,500 grafts or something.
Yeah, you took a graft from the back of and then but you also did PRP, I think, at the same time.
Well, what happens when you do a hair transplant? The reason why people lose hair, it's not a circulation issue. It's not anything
And this
else
is
like
men and
that.
women can get this done.
Men and women.
Okay.
And so what you do is the hair that's fallen out is genetically sensitive to dihydrotestosterone. So what you do is you take the hair follicles that are on the side or the back of the head, which are never going to fall out, and you just transplant them. Now, what happens when you transplant them, most of the times they go into a dormant phase. It takes about 2 to 3 months before they start growing again.
Okay.
But we found out with PRP, it kind of skips that dormant phase, and a lot of them will start growing immediately. So it kind of enhances the take, and it also speeds up the process so they feel like they can go back to normal.
So let me
quicker.
ask you, for women with thinning hair, not bald, just thinning hair, this is a good procedure too?
Well, it depends how much space you have in between the woman's natural hair. So if you have enough space to transplant a hair, then they're great candidates for it. What I've been doing recently is, over the past couple of years, we're using PRP as a hair loss treatment, and
without doing a transplant.
Okay. Usually what I'll try and do is I always try to be conservative. If somebody comes in and their hair is just starting to thin out, I'll say let's try this first. Let's strengthen what you have. Let's see if this works. And I put them on a combination of PRP with the matrix. It's called cell fill. So there are different ways that you can inject PRP. It's your platelet-rich plasma. We take it from
Right.
your own blood.
You spin
But
it out and then
we spin
inject
it out, but we mix it with this matrix, which kind of congeals, and you have to inject it with a certain amount of time, and it kind of sits there, so it bathes the hair follicles for a
Oh.
longer period of time with the and growth factors. And I have to say, everybody I've used it on got some results, some minimal and some very dramatic results. And then what
Wow.
we do is we also asked by our patients to use Rogaine, which is another. You want to do everything you can.
Yeah.
If they want to go buy that laser cap, go for it. You know, anything you can do to enhance it until the next better thing comes along.
Right.
And then we also use vitamins. So there's two different types of vitamins: Nutrafol and Viviscal. And
Viviscal.
they
Okay.
definitely
I've heard
work.
that. Yeah.
They definitely work.
Wow.
So they all help, but you know, a lot of it's all genetics, and not everybody can have the thickest head of hair in the world. And everyone, I always tell my patients, when you're 16 years old, no matter how great your hair is, when you're 50, you're not going to have the same. Even if you still have great hair for a 50-year-old, it's not going to be.
Not
the
gonna be like
same.
when you're 16.
No, and that's just the way it is. So a lot of it's hormonal, environmental, what we eat, what this
Yeah.
or that. So, but you know, once everything else has failed or at least stabilized, then we do hair transplants, and then we can also do scalp reductions. So if you don't have enough hair here to give a full head of hair, if your
Oh.
scalp is lax enough, we will actually cut out
Can
the
pull it
bald
out.
spot in a
Oh,
series.
that's interesting.
Right, and then you
Wow.
can save a lot of hair follicles, and then what you transfer later will give you a thicker head of hair.
That's interesting. Wow. Okay, so you've addressed a lot of issues. One more thing, women always ask me, what can I do about my saggy neck? You got a good fix for that?
Well, it depends. Like anything else, it depends on what type of skin you have, what the problem is, and what degree it is at. So we have everything now. We've got the surgical
All right.
approach, and we've got the non-invasive approach. So the non-invasive approach is the face type machine, which is the radio frequency,
Right.
which we talked about on the show one time. It's like a little needle that goes subcutaneously with an external probe that heats up the skin
Yep.
internally and externally.
And that'll
And-
tighten the neck area?
And I will tighten the neck, and the Morpheus, which is the microneedle. So we do that all at the same
Together.
time. Now it depends on the patient. It's these technologies, and this is the first technology that I've seen that really works well. They work. It's the couple of things that it depends on: how you do the procedure, and who you're doing it on. So if you pick the right candidate, you're going to get better results. So a lot of the problems in the necks are not just loose skin. If it's the muscle that's sagging,
Yeah, you got to
the
fix that.
technology doesn't really work. So it makes it better because it tightens up the skin around it and it pulls it back a little bit. But I've gotten some patients with super dramatic results because they were great candidates and we did a very good, aggressive procedure with them. But, you know, some patients are not going to have, you know, to me,
And as a surgeon, you can correct that muscle.
Right.
You know, a lot
See-
of other doctors use those machines because they can't do
you know, when I look at the
surgery.
befores and afters that the companies proclaim about their results, I don't know about other places, but in Boca, patients want perfection as much as they can get. So to me, a minimal improvement is nothing to write home about. So when you do something, you kind of want to knock it out of the park.
I agree with you.
You want to get a result, not just a slight improvement.
Right. And I think
So,
people are afraid of surgery, so sometimes they
Right.
opt for those other options when surgery would give them the best results.
Right.
And can you do just a neck lift? Is
You
it
could do just a neck lift, depending on the pay. If
Yeah.
they have a really good jawline and they don't have any jowls or a saggy cheek, you can just do the neck. Sometimes we could just do it through a little incision in the middle.
Wow.
Sometimes we just need to take a little extra skin. But then we do necks, mini facelifts, we do modified faces, and then we do full facelifts.
Okay,
So-
we only got a couple of minutes here. So I guess if anybody is thinking about doing any of these things, they can come to you for a consult. Do
Sure.
you charge for consults?
No.
No. Okay, so there's no reason not to go discuss whatever issue it is. I know you have a lot of fixes, and I've been impressed with a lot of the things he did to me. Love the fat grafting, love that it stayed. You know,
Oh, yeah.
you hear stories that it doesn't stay, and then my son, and then I love the endoscopic brow lift, and you also did the laser resurfacing
Yeah.
on me.
Yeah,
all those
I mean,
things.
you know,
So
if it's part of the restoration process. You have to address every issue that's that's causing the aging
like restoring a
process.
car. I know I gave you a picture of myself when I was 19 years old that you used to restore.
There goes those car analogies.
Yeah. Okay, Dr. Arthur Handal, plastic surgeon in Boca Raton, and the number is on the screen there. And go see him. Go for a free consult and check him out. Okay, thank you, doctor.
Thank you. It's always a
Okay.
pleasure.
See you next week. You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored